Okay, if you could give me a little thumbs up or just put in chat that you're seeing the presentation, fine. That would be super helpful, just so I know our tech is working well. Great. Thank you so much. Okay. If you were hoping that you were in the presentation about navigating the cost of care, you made it to the right spot. I'm so excited to have you here with me, and I'm so glad that you've been able to come to HFC's event today and get some extra support for your caregiving. I have this presentation broken up into really four parts. It says three on the screen, but we're going to go over some of the reasons why long-term care is so expensive and tough to pay for. Then I will share, and I'll kind of illustrate that with some storytelling with a friend that I call Beth that you'll get to know. I also will then go over some of the realities surrounding how families are getting impacted by the high cost of long-term care. And I want to hear from you guys, like what you're dealing with, and if some of the realities that we see across the nation are true for you as well. And then we'll get into a section that I call building your team. So, like putting people together that can help support you and help you navigate these financial challenges. In that section, I'm going to put a lot of links into the chat. I'll make sure that this gets shared after this event as well. But if you want to grab these links, copy and paste them into a document on your computer, click them as I share them across. I just want you to know that in that section, I'm going to be passing you hopefully some really great resources. And then the fourth part is I'm just going to make sure to save time at the end for some Q&A. Okay. So as I mentioned, my name is Kimberly Wider. I own and run a small business called Elder Care Solutions. I do all of my work with one big mission. I want to make sure that families don't become financially destitute because they are caring for an aging loved one. So unfortunately, most families are getting financially broken by long-term care. I think it's a horrible situation. I also completely recognize that it's extremely complex and there aren't simple answers. And I am not a financial planner. I do not sell financial products, which I think is a big positive for you guys. I'm not here to push or sell anything on you. I'm a guide and I help people navigate the professionals who can come in and help them the best. Um, a lot of my expertise that I pull from whenever I'm doing this work is a lot of work in interprofessionalism. So how do different professionals come together to do the most good for the family that they're serving, the patient that they're taking care of, any kind of like mutual goal. So that's enough about me for now. We're going to skip that because that tool that I thought we had, we don't have access to. So what I'll do, I would like to do one activity where you guys place yourselves on a scale between I'm not worried about the cost of long-term care all the way to I feel very worried about the cost of long-term care. So to do that, we are going to use a whiteboard. So I replicated that scale here. And so go ahead and use any tool on this left-hand side that you want. You can draw with a pen, you can put a little icon, but put yourself on this scale so we can see where we all fall today. And it should be anonymous. Nice. Keep going. Feel free to play around. I'm sure you've been sitting and listening a lot. Nice. Good job, guys. Yeah. Nice. Good work using those tools. I hope that's fun for you. Um, Anyone want to give voice? It sounds like predominantly we are with a lot of like-minded people where we're leaning into the feeling pretty worried. Does that feel representative and ringing true?
Yeah.
Yeah, yeah. Okay. I'm gonna X out of this, so just letting you know you won't be able to draw anymore for now, but there'll be some more moments. Okay, let me go back to our presentation. Thank you for interacting with that. Okay, so we are a predominantly 4 to 5 group. So here's Beth. Um, to give some context on why you see pigs a lot, because Elder Care Solutions spends a lot of time talking to families about um, finances and navigating the financial strains. Our mascot is a little piggy bank named Esther. And Esther joins me on a lot of presentations, sometimes physically, because I have a piggy bank that looks just like her and I carry her around with me, and sometimes virtually just like this. And she does some acting and takes on the role of whoever I need her to take on so that we can just educate families. So Esther's playing Beth right now. Beth is an 82-year-old woman. She broke her hip 6 months ago. Her hip surgery was covered by Medicare, as well as 90 days of post-surgery rehab. So now Beth is home. When she tries to stand long enough to cook for herself, she's finding that really hard. Bending down to do her laundry, moving around her house to clean up and tidy is really hard to accomplish for her. She's really struggling with pain from her surgery. Remember, it was only 3 months ago. And Beth can't drive. She hasn't been cleared to drive yet. And as you see from her calendar, she has a lot of appointments coming up. There's all these follow-up appointments, therapy appointments that she's been assigned to, and she's struggling to get to those appointments. This is a situation that rings true for a lot of families across the US. So we're going to hold Beth in our heart for a little bit and just learn a little bit about some stuff. Here's some problems that we're facing in the United States. Longevity, a pro and a con, right? So, great, we're living longer. We're actually the baby boomer generation is living on average 19 years longer than the generation right above them, the silent generation. That means in one generation, we gained 2 decades of life, which is incredible. Um, that's also because the baby boomer generation is the first generation in American history who, from the time that they were born all the way to the late chapter of their life, they've gone through modern healthcare. So they're very medically healthy. It's a very healthy generation. They face chronic conditions that in the generation right before them were death sentences. Diabetes, many cancers, chronic heart failure. Those are all things that people can now live with for a very long time, where in generations before them, that wasn't the case. So that means that the type of care that our aging populations need today in 2025, it looks really different. It's not a lot of medical care. It's not a lot of acute care that someone gets sick and then they decline really fast. It's more often what's called long-term care, which is help with things like what Beth needs help with, making sure she has access to healthy food, making sure that she has a safe environment to walk around in, she has clean clothes, she can bathe and dress herself. She can get to the appointments or even social engagements that she wants to. And that's the kinds of things that our aging populations need more help with now than in generations past. Additionally, our government supports for long-term care has massive gaps. Medicare is just for our medical care, and it does not cover long-term care at all. And for many families, this is a big surprise. They will think like, sure, when mom needs some help when she's older, we'll find someone that can come into her home and help her out, not thinking anything against maybe a self-held reality that that's something Medicare will cover, and that's not something Medicare will cover. So it's there for the doctor's visits and the copays and the surgeries and the health events. But when it comes to someone coming into your home to help out, assisted living, memory care, they really just don't touch it. We also have never really gotten to a strong, clear, fortified definition of what long-term care actually is. It's firmed up some over the years, but it's still kind of gray, and some things are categorized as that and some things aren't. And so they haven't really done a good job to decide like, okay, this is long-term care and here's some systems that can be used to cover it. For some families, many families who maybe spend down a lot of their assets because they were putting a lot of it towards long-term care, they then can turn to another governmental system, which is Medicaid. That also has a lot of problems. In some states, there's gigantic wait list. Um, Although it is a governmental provided support, it's state administered. So it's different in every state that we have in the United States, which makes it like not very standardized. Um, and it's really hard for most middle-class families to even meet the requirements to qualify for Medicaid. So there's some big issues there. The most robust long-term care support that we have that comes from the government is Veterans Affairs. But of course, not everyone is a veteran, or not everyone's parent or is a veteran or surviving spouse of one. So it doesn't apply to everyone. But they're doing the best job in supporting long-term care needs across the United States. And then lastly, to fill these gaps, we've seen a lot of private companies try to come in with advantage plans. They're privatized. Some public supports like area agencies on aging, but these social supports are still really fragmented. They're not talking to each other really well. They're giving you a system that you still have to navigate and get passed around in circles before you can find all the help that you need. So altogether, the fact that we have a gigantic generation that's living for a very long time and medically is very healthy and has long-term care needs that look really different than any other generation that we've had before, with a governmental system that isn't really covering all the bases, and then a pretty fragmented system. And when we look to other public and private sectors, it's just kind of a mess for families to navigate. So if we go back to Beth and see how like this is really impacting her, we know that Medicare covered her surgery and some limited rehab and probably like some pain meds that she needed. She has some saved money from a pension, and that money is disqualifying her from accessing Medicaid, so that's not available to her. She's not the surviving spouse of a veteran, so she can't access the Veteran Affairs support for long-term care. So what's Beth left with when it comes to her trying to figure out like how can she make sure she has healthy food because she's struggling to cook? How can she get that help for transportation because she needs to get to all her appointments? How can she get some help with personal care because her recovery from her hip surgery is making it hard for her to get around, probably to bathe and get dressed sometimes. And she needs some help with housekeeping, right? So her space is safe. It's been proven in so many what was I was going to say reports, but in studies, in so many studies over and over, that it's not necessarily the successful surgery that sets someone up for success in healing and getting over what caused them to have the surgery in the first place. It really is all the support and the social components that they have on the other side of the surgery that has the biggest impact on how someone heals, how they get back on their feet, and how they're able to recover and get back to a normal life. If Beth needs additional therapies past these initial 90 days, she's going to have to private pay for that, which is really hard for families. And if anyone has navigated with a loved one who had something as big as like a hip surgery, that 90 days was not enough to get them back on their feet. They need more. So there's a question from Brennan. For the Veteran Affairs support for long-term care, their surviving spouse of a veteran also gets coverage. They're a qualified person who can get financial support for long-term care needs. Here is another interaction. So I'm going to pause this and bring up our whiteboard. What I'm asking you is, have you experienced any of these? So these same questions are going to be on the whiteboard whenever we switch over. And you again can use the pen or however you want to annotate just to place yourself inside the circles to say, yeah, this is a part of my reality. All right, let's bring it up. Oh, that's not the one I want. There we go. So if you have paid out of pocket for care costs, if you estimate that perhaps you've spent around $7,000 over the past year on care costs, you can just check or add anything to that circle just to be like, yep, I'm in here. I'm in this bucket. If you've been using your income to supplement the cost of care needs for an aging loved one, if you've used any funds from your savings accounts to pay for care, or if you've been looking for answers everywhere and you feel like you've been getting passed around in circles over and over, let us know if you're in any of these buckets, any of these circles. Great job, guys. Looks like we have people who have done all of these. Nice. Lots of getting passed around in circles. Thanks for sharing that. Okay, looks like voting has slowed down. Great. Go back to our presentation. Okay, so let's look at what this has looked like for American families, because we have data on this kind of stuff. So for people who are incurring out-of-pocket costs, so they are using their own money out of pocket to pay for care needs, around 78% of American families are doing that. So you're in good company, those of you who were in that bucket. The national average as of 2021, there hasn't been too many robust reports since 2021. The national average of that out-of-pocket expense was around $7,242 for the year. There's an estimated 40% of working family caregivers who spend their income, and it's around 40% of their income, which is such a large percentage, Over 20% of families are spending down their own savings, and many families are losing legacy items. So, savings that they were hoping to pass down to earlier generations, later generations. And then it has been proven over and over that families really don't have any idea where to look. And when they do find some good portals, like, oh, here's a door that looks open, they just get passed to another agency who passes them to another agency, and they just kind of get swept up in the whirlwind. And um, that's very frustrating for families, very heartbreaking when they don't find the solutions that they really need. One thing that I really like to message when I give this presentation is that this is not your fault. I've worked with a lot of families who maybe came into their first session with me, and they were carrying a lot of guilt that they thought they weren't looking in the right place. The reason they were struggling to pay for long-term care is because they didn't do a good enough job saving money. None of that is true. This has nothing to do with how you've set yourself up for success. It has everything to do with how we do not have the support systems in the United States to help you succeed. So I just want you to release any of that burden if you're carrying that in your heart or on your shoulders. It's not something that you have failed at or you didn't do. Uh, it should look better for you. Okay, this is the section where I'm going to share some resources with you guys. So I'm going to share some links as I talk about different agencies or professionals that could potentially be of benefit for you. It's very likely you have tapped into or heard about an area agency on aging. If you haven't, I just want to always make sure I share it. The structure is each state has a Department of Aging and Disability, or sometimes they're two separate things. That state receives monies from the federal government. The state then oversees an area agency of aging in every uh, geographical area within their state. Sometimes it might just be one zip code. Sometimes in more rural areas, you'll have multiple zip codes clumped into one, but it should be a geographical area that if you needed to get into your car and drive to it, it would be within a reasonable distance. So some states have a lot more than others, depending on the size of the state, but every area within a state has one. This is a state-run public entity. They pay for the salaries of the people who work there, who are often social workers, counselors, geriatric care managers, and other professionals. And they receive grant monies from their state to run programs that the people within their regions, within their areas, find the most helpful. So two important things about that is if you call up an area agency on aging, they are 100% there to help you and they're being paid to do so. So you shouldn't have any qualms calling them up and seeing how they can help you. The other thing is, unless they get feedback from their communities on what is really needed, they often don't really know what supports are going to help them most. So there might be like, yes, caregivers really need help with these three things, and we'll make sure we have programs to cover it. But there might be specific things in your community, like, man, we really lack support for transportation in our community. They need to know that because then they can ask for grant monies to support a transportation program, right? So the link that I'm going to share, get there, I'm sorry. A website that will help you find your area agency on aging. Hmm. No, well, that's not helpful. Yeah. Yeah. This link, when you go to it, all you have to do is put in your zip code and it'll tell you what your area agency on aging is, what the name of it is. You'll get the website, the phone number. Because these are public entities as well, the staff do display like their email addresses and their phone numbers so you can even reach out to individual people. So this is a really, really great resource. In line with area agencies on aging, nonprofit organizations are also really great resources for you as a family. They also receive grants. They also most often have really great support groups, and they too are responsive to what people who reach out to them need. Um, I have some really great links on nonprofits that you can find like across the nation. So there's like at the national level. Um, I would suggest that if you're looking for something that is very close to you, um, be patient with your Google search. A lot of nonprofits are working on limited budgets. They have volunteers. Um, So they don't often like get up in the SEO whenever you try to Google them. But if you say like nonprofits that support caregiving in Roanoke, Virginia, which is where I live, you'll often get a much better response from Google and then have a browse around to see what you're able to find. This Elizabeth Dole Foundation is very specific to caring for veterans. They do a lot of work to try to make that as healthy and supportive as possible. Um, this caregiver action group, which I'm sure a lot of people have visited before, they can help you find some nonprofits that are kind of in individual states. And then here is another government website that kind of shows you different programs that are going on across the nation. Don't forget to tap into your employer. A lot of caregivers forget that there might be some employee benefits that are available to you. More and more organizations are being very thoughtful about the fact that a lot of people in their workforce are taking care of aging parents, and they're trying to bring on really great organizations, direct support for caregivers, or even thinking about if they can like subsidize some of the costs of being a caregiver. So it's always worth tapping your human resource director or your manager or supervisor and just letting them know like, hey, I'm in a caregiving situation, just wondering what we have available to us. I've also seen things like some free legal help. Maybe they cover a couple or a handful of sessions with an elder law attorney. Maybe you get a few sessions with financial planners. And then of course, it's rare to work for an organization that doesn't offer like some emotional support and mental support for intense situations that you might be going through, and caregiving definitely falls within that bucket. Um, I also want to bring up Medicare brokers. There are people all over the United States who are independent brokers, and they don't work for any one insurance carrier, but they represent kind of all of them. And they get paid by the insurance carriers. So they work with families for free, and they just want to hear like, what does care look like for you? What are some of the realities about healthcare that your loved one needs? And they look for plans across all the carriers to try to find something that would give you the most coverage for the least amount of out of pocket. I've had multiple families that I've worked with that have saved anywhere between $1,000 to $3,000 a year because their insurance that they did have just like wasn't a great fit. And when they really sat down with a broker and figured out something that worked better for them, they just saved a lot of money because a lot more of the care was covered. And so that's just like a really great way to take a look at the insurance that you have. whether it would be beneficial to switch it up. I know looking at insurance plans and signing up for a new one is not fun work. These people are experts at it. I just shared a link to an article on why this is a really great idea to go talk to somebody who does this kind of work. And so hopefully that'll help you out there. I also want to bring up technology. There are so many new technologies coming out that have been designed specifically for you as a caregiver. The goal is to make caregiving easier, to help you collaborate with other family members better, to help you put all of the important information in one place. So they're really thinking through what a caregiver needs and what's going to make it as easy as possible. Um, Here's some great links on different tech that different organizations kind of spotlight. Uh, a lot of you might have used like Caring Bridge before. That's been really great. There's some awesome apps you can get on your phone to talk to family members. They can even help you talk to maybe like a home care assistant who's coming into the home, and it gives you a great way, like two-way communication with them. You can upload documents into apps, have stuff all in one place. So these are some really great options. I'm also going to throw my tech solution in there to help you learn about the different financial solutions that you might have available to you as you're navigating care. I'm sure a lot of you have heard about elder law attorneys. I just want to highlight why they are kind of super people whenever we are dealing with our aging loved ones and navigating long-term care. Um, they do more than a lot of people think that they're able to do. So um, there is estate planning, so they can sit down and you can kind of put all the cards on the table, say like, here's the estate picture of what my parents have, we have, and like what all needs to be considered. They definitely are there to help you get all of your powers of attorney in place, which is financial and healthcare. Most great elder law attorneys put up no boundaries when it comes to getting these essential legal documents in place because no family should not have one. But they're also really awesome at Medicaid planning. So it's not a false statement to say that most American families couldn't pay for long-term care for a very long time. Which means the reality is at some point we're all going to run out of money and our aging loved one is going to continue to live and we no longer have any money to put towards that care. So Medicaid is it's a reality on everyone's horizon at some point. The question is like, when is that activated and what's the right time for us to activate that strategy into a long-term care plan? And elder law attorneys are really great at this. They can take a look at all the assets. They can offer up legal strategies for protecting certain assets, leveraging others, and when might be a year or even a month in a year where we say, this is when we need to kind of activate the strategy of Medicaid. And some of them also have certifications in veteran affairs assistance and can help you navigate applying for that, getting the most reimbursement for care costs through the veteran affairs, and like handling any claims that there might be issues with. So really great. The link I'm going to share for this particular strategy is an association called the Life Care Planning Law Firm Association. I think they're fantastic. They are dedicated to working with families who are navigating long-term care and people who are identified as caregivers. They commit to having like a social worker or a geriatric care manager or someone like that in their practice so that you really get your hand held and can navigate through long-term care situations in the most holistic way possible. Financial planners are awesome because they can help you leverage any any long-term savings that you have. The main thing here, in addition to our professionals that help with taxes, is we don't want to take out giant lump sums of money. So we'd be like, okay, here's a whole bunch of money that we can use to pay for the next year of care. Maybe we want to take it out in different ways, all to our tax benefit, right? So they can give you all the strategies for leveraging your long-term savings and minimizing the taxes that you have to pay or the penalties you have to pay for leveraging things early. So you really need those kinds of professionals to help you navigate that. Of course, there are professionals who sell life and long-term care insurance products. Most of our parents don't have these products in place. Maybe life insurance, definitely not long-term care insurance. It's more rare for me to find um, families who have long-term care insurance. And that's for good reason. When a lot of our aging parents were in their 30s and 40s, when it is more strategic to put those products in place, like to buy them because the premiums are at an affordable rate. Um, Long-term care insurance products in their time, when they were in their 30s and 40s, were really bad. They didn't offer a lot of coverage. You would hear a lot of stories about people who needed long-term care, and then when they would go to get coverage from their insurance product, they would always have reasons why that wasn't covered, and so they weren't getting payouts. So a lot of people made smart decisions not to get those types of products. They've come a long way. They went away for a while, then they came back on the scene. Um, and now you often see hybrid products. So it'll be like a long-term care insurance with an annuity or something like that. They're better. And you'll see the generation that we're in, where we're the caregivers, we're picking up products like that because we see how it might be useful for our own futures. Um, but if your loved one has life insurance or long-term care insurance, there are ways to use those in unique strategies. Some of them can be sold, some can be tapped into before death, so you get some benefits on the front end instead of the back end. It's always just worth exploring and talking to the right people to find some of those nuances of those that the typical layman doesn't know a lot. Thanks, Christian. I'll get to that in just a second. And then I just want to bring up also housing wealth. So if there's any interest in HELOCs, reverse mortgages, any other home equity strategies, there's some really great professionals out there who know a lot about that. And it's always worth asking questions and then deciding, that's not for us, or wow, would have never known. So I always want to bring that up. If you live in a state that does not have an attorney who's part of this law firm association, and they're not a gigantically robust association, um, then I would suggest whenever you look for elder law attorneys, do a few things. One, make sure you specifically look for elder law attorneys, not just attorneys, because you want the attorneys who have specialized in elder law. Look for elder law attorneys that consider caregivers in any way. So they're not just looking for senior citizens to come their way and do like asset protection and that kind of work, but they know and recognize that there's family members taking care of a lot of our senior citizens. And then the third thing is I always look for free consultations. To me, it's a really great sign that they have a fee structure that's really fair, and they're trying to open up the door for you to see if what you're going through is a good fit for the services that they provide before they start charging you on day one. So those typically are really great signs. Elder law attorney, um, they speak to caregivers on their website. They mention caregivers. They recognize caregivers are part of the equation, and they have a free consultation. Okay, we have about 10-15 minutes, I think, for questions and answers. So would you guys like to do that? Can't promise I have an answer for everything, but I always try. I'm happy to stay. Oh, listen, that's great. I'm so glad that your area agency on aging had that. Mm, great question, Merritt. Um, or Mary, I guess. You'd have to ask the Medicare policy directly on if they can go beyond what they say is their initial coverage. Or if there's maybe they don't cover the full cost, but do they have like co-pays after that? You would have to explore with them, which I know is not always the most fun thing because who likes to call the insurance policy? Um, and then if the answer is completely no, that's another great thing for area agencies on aging to see if they have any partnerships with speech or PT therapists, or if they work with any home care agencies that offer those kind of services that you could get at maybe a lower cost. Thank you, Matt. It was good to have you here. You might be gone already. Okay, I'm gonna put my email address. I'm staying. I'm not going anywhere, but if you feel a little shy to talk, um, here's my email. You can reach out anytime. I offer one-on-one guidance sessions. And so for 30 minutes, we can just talk about your situation specifically and brainstorm some solutions, some resources that might help you out if that seems helpful and useful, or you just want to ask some questions before you decide, please feel free to email me and we can talk about it. Anybody else have any questions? Yeah, for sure, Mary.
Hey,
Hi, Alyssa.
Kimberly. Hi.
Hi.
Hi. I just wanted to thank you for yeah, highlighting that it's not our fault and that it's
Yeah.
just a really complicated system. I felt so foolish for like choosing a Medicare Advantage plan that offered like more at-home health care, but then it wasn't until my mom passed away, like months later, that they were able to like find a healthcare provider or like an at-home care
Oh,
person, and I was like felt so foolish for like wasting the money. And then also like, oh, I should have planned it better. And like it's been really hard to accept that like this is just really hard. So I appreciate you highlighting that it's
aw.
so complicated. So thank you for that.
Well, thanks for sharing that. And I'm so sorry you went through it, but you're right. It's just like, it's not an easy system to navigate. You're making the best choices you can with the information you have at all times. Um, and it's really not set up to make it easy for you to decide on things. So definitely not.
Absolutely. And I'm glad you mentioned the agency on aging because the one in Colorado in Pikes Peak one, I don't know what I would have done without the caregiver support person.
Nice.
They were really good about saying like, okay, this is what you need to plan. And I was like, whoa, time out. My mom's not there yet. And then and then like 6 months later, it's like, oh my gosh, we're there now. We have to figure this out. So
Wow.
it was like really good to have like somebody who I think was previously a hospice social worker. And so, yeah, I thought I was so glad for that resource as well, because that was tricky. So glad you mentioned that.
And it really wasn't long ago before whenever you didn't even see like caregiver services or a caregiver navigator at area agencies on aging. So it's kind of I would say within the last decade, but mostly a big like explosion in the last 5 years. And now you'll see that there's like a dedicated person on staff who's there just for the caregivers, and that's so great because they're really the ones making the decisions and navigating everything. Yeah.
Yeah. No, that I didn't realize it was such like a recent thing, and I'm glad you
Yeah.
mentioned that it's funded by the state because I felt like I didn't get a lot of support like when I was trying to determine the Medicare thing and or like which Medicare plan to use. And I like I felt really bad, but I like reached out to a supervisor. I was like, I need assistance, and I felt like really dramatic, but they were right away like, okay, we're clearly not, offering the support we need for the community there. So it was
Oh,
I'm
that's awesome.
glad you mentioned that as
Awesome.
well.
I really appreciate it. Yeah, thank you for coming off of mute and sharing your experiences. Um, if you've had them, many other people have as well. Yeah.
Totally. Yeah, no. Yeah, I'm gonna jump off, but thank you again. This was
Okay,
really
thank you
helpful
so
to,
much.
yeah.